Congressman Jim McDermott and I are very pleased that you're here today. And we're very pleased to be joined with Arlene Baker Holt of the AFL-CIO, Gene Ross of the National Nurses United, and Matt Biggs of the International Federation of Professional and Technical Engineers, and many other labor representatives to talk about the need for real health care reform in this country. And what Congressman McDermott and I and organized labor are saying is enough is enough. Now is the time for the United States of America to join the rest of the industrialized world and say that health care is a right of all people, not a privilege for the few. We are here today to advocate for and bring forth legislation which provides for a Medicare-for-all single-payer program which will guarantee health care for every man, woman, and child in this country. The major issue that we as a nation, in terms of health care, have got to resolve: is health care a right or is it not? And we say, along with the vast majority of the American people, that it is a right. The second issue that we have to resolve is, if we are going to guarantee health care to all of our people, how do we do it in a cost-effective way? And the only way you do that is through a Medicare-for-all single-payer program. We are sick and tired of seeing up to 30 cents of every health care dollar going to administration, going to billing, going to advertising, going to profiteering. Health care dollars should go to health care, not to make CEOs extremely wealthy. When a doctor works with a patient, examines a patient, that doctor should give that patient the best possible treatment, not worry about whether the patient can afford the cost of care or the very high cost of prescription drugs. So what today is about is saying that health care is a right, and we're going to go forward in that direction. I would point out that as someone who supported the health care reform bill of last year, that after health care reform is passed, after it is implemented, we are still going to be looking at 23 million Americans without any health insurance at all. After health care reform is passed, we are going to continue to see the cost of health care soaring for businesses and for working people as well. So I think that health care reform is a step forward. We have got to go a lot further. I am very proud that in the state of Vermont, our small state may well be leading the nation in a new direction. Our Senate and our House are going to go forward and pass a Medicare-for-all single-payer program. Our governor is prepared to sign that legislation, making Vermont the first state in the country to go forward with single-payer. My hope is that we can get the waivers now lowered to 2014, which will allow the state of Vermont to use the federal resources that it will be receiving for a single-payer program. So we are making some progress, and now we are working with organized labor to make the day come sooner when everybody in this country has health care as a right. It is now my pleasure to introduce a gentleman who has probably worked harder than anybody in the United States Congress for decades on the concept of a Medicare-for-all single-payer program, Congressman Jim McDermott of Washington. Jim.
Thank you very much, Bernie. It's really exciting to watch what's happening in Vermont. I started back in the state of Washington in 1984 with the Washington Basic Health Plan, trying to do what Vermont is doing in 2011. So there have been a lot of steps along the way trying to make this all happen. I'm a supporter of the Affordable Care Act. It's a start, but it has in it the provision for waivers to states to run their own system, which is basically what the bill that I've been introducing and Bernie's been introducing for the last 20 years has been a single-payer system state by state. Some state is going to step out and make it happen. And it looks like Vermont is poised right on the verge of doing it. Now, as Bernie says, the problem with the Affordable Care Act, if there is one, is there's still a lot of people who aren't covered. And in order to make a system really be able to control the costs, you have to have everybody in the system. You can't have a large segment of the population who are coming into emergency rooms in extremis rather than having preventive care. You have to do preventive care and give people basic primary care before so that they don't wind up being so costly in the emergency room. What's also exciting about today is having the California nurses. They've tried it in California. They came within inches of doing this in California a few years ago. So this isn't just Vermont that's thinking about this. This is people all across this country. And to have organized labor and the nurses who have been looking at this situation backing us is really very heartwarming to see that it's coming together to back what's going on in the upper right hand or left, let's see, I guess it's the upper left hand corner of the United States. And you are looking at a little tiny state, but it's going to happen all over the place because it is an idea whose time is right.